Hello, you are welcome. Today we are discussing the condition which affects the eye. Discussing glaucoma. So we are saying glaucoma is a progressive eye disease caused by damage to the optic nerve which leads to vision loss. Or the other definition say glaucoma is a disorder in which the pressure in the eyeball increases, damaging the optic nerve and causing loss of vision. Okay. What are the causes? The causes is not known. Okay. There are some predisposing factors which include the following: a family history of glaucoma, diabetes mellitus, eye injuries, prolonged use of cortisone drugs. Okay, now let's understand about the condition glaucoma following this simple pathophysiology, so just a simplified one. So glaucoma is a condition in which intraocular pressure is increased above normal. The normal range is 10 to 20 millimeter of mercury, 10 to 21 millimeter of mercury. The intraocular pressure is determined by the rate of aqueous humor production and the resistance to the outflow of aqueous humor from the eye. Normally, aqueous humor enters and leaves the eye, the anterior chamber, so that the intraocular pressure is maintained in normal range. Increased intraocular pressure can be caused by a number of changes that affect the flow of aqueous humor in the anterior chamber of the eye. It is often caused by some interference with the outflow of aqueous humor. That's aqueous humor, not tumor. Increased intraocular pressure may result from hyperproduction of aqueous fluids up in the eye. The increased intraocular pressure inhibits blood supply to the retina and the optic nerve, resulting into visual impairment. Peripheral vision is lost first. So peripheral vision is the one which is lost first. The field of vision gradually narrows until the patient has tunnel vision. As the disease progresses, the patient loses sight completely. Okay, that's a diagram for an eye showing the lens, the anterior chamber, the cornea, the iris, and the second diagram shows primary angle glaucoma and closed angle glaucoma. So A is for primary open angle glaucoma and B is for primary closed angle glaucoma. Primary open angle glaucoma, this is where the optic nerve is damaged due to increased intraocular pressure. The possible causes of increased intraocular pressure in primary open angle glaucoma include overproduction of fluid within the eye and reduced outflow from the eye. In primary closed angle glaucoma causes sudden attacks of increased intraocular pressure. In this condition, the space between the iris and the cornea, where the fluid filters out of the edge, is narrower than normal. There is rapid increase in intraocular pressure. This is considered as one of the medical emergencies. So as you can see, in primary open angle glaucoma, the distance is normal, it's open. The angle is not narrow. In closed angle glaucoma, the angle is narrower or is closed, which leads to increased intraocular pressure. Then you have secondary glaucoma. Secondary glaucoma results from ocular diseases that cause a narrow angle or increase in volume of fluids within the eye. The condition includes uveitis, intraocular tumor, diabetes mellitus, and many more. Congenital glaucoma, this results from a failure of normal development within the angle of the anterior chamber, resulting in some blockage of aqueous fluid outflow. Okay, before we come to the treatment, what are some of the signs and the symptoms? Okay, so there's acute pain, which can be mainly in closed angle glaucoma. There will be blurred vision. Remember, these are just general signs and symptoms. They are not specific to primary closed angle glaucoma only. So the acute pain, which is common in closed angle glaucoma, there will be blurred vision. The patient will be experiencing some halos of light. There will be also headache, nausea, and vomiting. These are more common in primary closed angle glaucoma. In primary open angle glaucoma, there are also some signs and symptoms, which is narrowing of peripheral vision, mild headache, and vague visual disturbances like halos of light. Okay. In a congenital glaucoma, there will be photophobia and papillomos. Okay. Now, in glaucoma, a patient may be having some loss of peripheral vision, of which the patient may not be able to identify that he's having some loss of vision until they only have a central vision. Okay. So what are the investigations that can be done to patients having glaucoma? One of the investigation is visual field testing. This is to determine the peripheral vision loss. You can also do visual acuity. Then you can also do tonometry using a tonometer. This is to monitor the intraocular pressure. So what will be the treatment? The treatment can either be medical or surgical. In medical treatment, you can use miotics like pilocarpine eye drops. You can also use beta-adrenergic blocking agents like timolol eye drops. You can also use carbon anhydrase inhibitors like Diamox, which can be given per oral. Okay, and many more drugs which can be used. Surgical treatment. A trabeculectomy can be done. This is a surgical removal of the trabecular meshwork so as to promote drainage of aqueous humor. Then a lesser trabeculoplasty can also be done. This help increases the size of the space between the fibers, allowing the outflow of aqueous humor and reduce the intraocular pressure. So that's the end of our presentation. Remember, this channel is not a substitute of school and the hospital. Thank you.